Howdy, howdy, hey y'all. Welcome to Spillin the Tea with Saafiyah, the podcast. This is the podcast that spills tea on everyday topics that impact everyday people. I'm your host, Saafiyah, and I'm here to serve you piping hot discussions, insightful conversations, and a whole lot of tea on the things that matter most. On this podcast, we're all about keeping it real and getting down to the nitty gritty. We explore a wide range of subjects that touch our lives and the world around us, from relationships, mental health, and personal development to social issues, pop culture, travel, and everything in between. We've got you covered. Our goal is to empower, educate, entertain our listeners. If these kinds of topics interest you, be sure to tune in when we stream live weekly on Facebook and YouTube. And please like, share, and subscribe on YouTube at Spilling the Tea with Saafiyah. So if you're ready for the tea, grab your favorite beverage, settle in, and get ready to sip on some truth. Today we have a very special program, very special podcast. We will be we will be discussing birth trauma. So, what exactly is birth trauma? Everyone wants to know, right? Birth trauma refers to physical and psychological injuries that occur during the process of childbirth. It can be caused by various factors, such as prolonged labor, the use of medical interventions, complications during delivery, or the size and position of the baby. Physical birth traumas can result in injuries to the baby's head, neck, and other body parts, while psychological trauma may affect both the mother and the infant. Birth trauma can have long lasting effects, including developmental delays, physical disabilities, and emotional difficulties. Prompting recognition, appropriate medical intervention, and emotional support are crucial in addressing birth trauma and promoting the well being of both the mother and the baby. Well, today I have two very special guests here. I have Miss Chelsea, who will be talking to us about her experience with birth trauma. And then we have Dr. Julie here, who will be providing some insight as we go through this podcast on how to uh, take steps towards healing. Chelsea, can you introduce yourself?
Yes. Hello. Thanks for having me. My name is Chelsea Anderson. I am from Houston, Texas. I am happily married and have a beautiful, healthy, despite the arrival to the world, almost 4-year-old daughter named Presley. And yeah, that's me.
Well, thank you so much, Chelsea, and welcome, and thank you for joining us. Dr. Julie, can you introduce yourself?
Absolutely. Hi, my name is Dr. Julie Bindeman. I am a reproductive psychologist. So I work with people all along the reproductive spectrum, and I own a practice outside of Washington, D.C. called Greater Washington Therapy. Reproductive psychology is a topic that I write professionally on. I write for the average person on, and I certainly do podcasts like this. Um, and work with actual people that have experienced reproductive trauma.
Well, thank you, Dr. Julie, for joining us and welcome to the podcast. Dr. Julie, how prevalent is this birth trauma
So
situation?
it's hard to give exact figures because so much of birth trauma might not be identified by a medical professional, but instead is in the eye of the beholder. And I think that's a really important consideration to think of because I think a lot of times when we think about trauma, we think that there has to be some kind of specific occurrence that happens, but also trauma can be based upon a mismatch of what expectation and reality are, or it could be how somebody is treated and the medical professionals or healthcare professionals might not think they're treating somebody differently, but again, it's that subjective experience. So the estimation of birth trauma is up to 30% of people will experience some kind of birth trauma.
Okay. Wow. That's
A lot.
30% is a lot. So by day, many people might not know this because, I do this podcast, but by day, I'm actually a certified nurse midwife. And so oftentimes seeing patients, you don't readily realize early during the prenatal care that a woman might have experienced birth trauma in her previous pregnancy or during her previous delivery. So I'm hoping to gain some insight from this podcast on how to identify earlier.
Well, and I would also add that a person who might have experienced some kind of sexual trauma earlier in life is at greater risk of experiencing birth trauma, because trauma, if it's not worked through, gets held in the body. And so I'm sure as a midwife, you've seen people whose, cervixes just won't open, and there's no physiological reason for them not to open. But one theory is that it's trauma that's keeping it closed. It's a way that the body is trying to protect itself from invasion or from harm.
Makes sense. It makes sense. Okay. Well, that definitely puts things into perspective for me. Um, Chelsea, tell us a little bit about your experience with
Okay,
birth trauma.
I'll kind of chime in a little bit to what Dr. Julie was just saying. I find it interesting. You'll learn that I had.
Uh-oh. She's stuck in time. Okay, hopefully she'll reconnect. I hate when that happens.
The internet give it, and the internet take it away.
That's it. Okay, there you go.
Anyways, anyone who was at the hospital or in the room when everything was going on would clearly know that I went through some birth trauma, but the average person, even my doctor's offices, those people weren't really aware too much as to what went on. And so it is very interesting to realize the amount of trauma that does happen during birth, and for medical providers to not really be able to see or understand that unless it's fully disclosed. So
absolutely. So I'm taking it that the birth trauma occurred with a previous pregnancy, and then you had another baby?
No, I've only been pregnant and had one baby. I've only been pregnant once with one childbirth. I was 40 weeks exactly, and my provider wanted to induce me. I did not do any kind of research on the way I wanted to give birth. I didn't have a birthing plan. To me, it was no plan was better than a plan, because you never know it was going to happen. So with history of how big my husband was as a baby and whatever, my doctor thought it would be best to induce right at 40 weeks and not let me go any further. So I went in for an induction about 6 p.m. And contractions overnight. Wasn't very fun, nothing really happened, just a little bit of uncomfortable, whatever. When I saw my game plan for the next day was, okay, when my doctor comes, I'm going to ask her to send me home, because what am I doing here? I was not dilated at all. I was just laying in this bed with nothing but just minor contractions. My doctor walked in at about, I think it was like 7:30 in the morning, and my water immediately broke. Like, well, there goes my game plan of going home. So I guess we'll hopefully have a baby soon or whatever. So she said, all right, well, I'll be back this afternoon and we'll have a baby. I'm like, wonderful. Still not dilated. Nothing was really going on. Like, okay. So I want to say it was about 8:30-ish in the morning. So I'd been there a little over, 12 hours, 14 hours. Like, hey, can I like sit in a chair, get out of this bed? It's uncomfortable. I want to walk, do something. Like, well, we don't want you to walk, but go ahead and have a seat. They brought me in this rocking chair. I joke that my mom sat in it because she gave birth at the same hospital I did. And this thing was so old school, just straight up wooden rocking chair. I'm like, all right, okay, sounds good. So I get in the chair, and a couple minutes later, I don't know, I had like a little blackout moment. I just couldn't really see anything. I started sweating really bad, and it was about 30 seconds. My mom was like, you okay? Like, I don't know, I felt something weird, but I think I'm fine. She's like, okay. Do I need to get a nurse? I'm like, no, I feel fine now. Well, in come the nurses. Lost the heart rate monitor moved, and now we see because you are sitting in a chair. So let's get your monitor back and get you all hooked up right, and we'll move along. Okay. Couldn't pick up the heart rate. So then she says, okay, go ahead and lay in the bed for me. Okay, lay in the bed. Couldn't find the heart rate. So, and by this time, so first it was just a couple nurses that had come in. And by this time, now it's, I don't know, maybe 10 nurses. Now a doctor's running in there. They're doing the vaginal monitor where they poke the baby's head, not picking up anything. So I don't know. It's just a flurry. I'm like, okay, keep your composure, because my husband and my mom are right there, and I'm not trying to scare anybody else. But then I'm like, what is happening here? So then I'm hyperventilating. They're, trying to put oxygen on me. And I just remember hearing like, okay, we're going to take her to the OR. We're going to take her to the OR. I'm like, okay, here we go. So rushing to the OR, emergency C-section. Last vivid memory I have is that, God, the lights were so bright in that room.
Yes.
Climbing on the bed by myself, big old belly, like what is happening? The most amazing anesthesiologist in the world trying to comfort me, and we're gonna be okay. We're gonna get you through this, because I hadn't had an epidural or anything yet, so they immediately put me under anesthesia. I found out like a month later that I didn't really talk about it afterwards. I found out like a month later that I knew the whole time. I stayed in the OR for like 3.5 hours after they delivered my daughter. And that whole time I thought that maybe like my husband and my mom hadn't seen my baby yet, but she was delivered in a matter of 12 minutes. From the time they lost the heart rate to the time they delivered her was 12 minutes. Like, okay. So she did skin to skin with Daddy for the first 3 hours of her life, while they waited on X-ray to come in and make sure there were no instruments left over inside of me from the operation. So finally, it was about 3.5 hours. I got back to the room. I was out of it. I had no idea why there was a baby in the room, whose baby it was, why he was holding a baby, what's going on. I have a lactation consultant, okay, it's time to feed. It's time to feed. I'm like, feed who and why? What am I doing here? What's going on? And I think I'm going to throw up. So can I get one of those bags, please? So I guess what ended up happening was my uterus ruptured. And so the baby obviously lost oxygen. It was quite the scene. I still never dilated. My doctor came to visit, while I ended up staying in the hospital for 5 days. My doctor came to visit the next day. She made it in time to stitch me up. And she walked in and was like teary-eyed. I'm like, why are you crying? And she's like, I just want to make sure you're okay. Like, I was like, and I'm just bawling. I'm like, I just don't know what happened. I don't understand what happened. Is everything okay? I didn't come to until probably 8 p.m. that night. My daughter was delivered at 9:12, I think is her birth time official. And then I'm like, oh, okay, I had a baby.
Wow.
And I'm here at the hospital. And that was the worst pain of my life, trying to heal from that surgery in general. But yeah, it was an eventful 15 minutes to get her out, and then what felt like forever for me, but it was I think this is the first time I've ever spoken about it without crying.
Okay.
And it's been almost 4 years.
Wow.
And then I ended up having just like some different issues with that doctor's office. So I switched doctors and asking her, can you please tell me what happened? And she says, well, I don't have the hospital notes, but I have your doctor's notes. And I see that she had to do a B-Lynch suture, which means like your uterus wasn't contracting. And I see that you lost a decent amount of blood. I'm like, well, this is all new to me. This wasn't the answer I was looking for. And she's like, you didn't know all of this? I'm like, no, what the heck is a B-Lynch suture? And she's like, well, it looks like it almost didn't stick. And that leads to a hysterectomy if it doesn't stick. Wasn't contracting. I'm like, okay, well, I was wondering what caused all of this. And now you're telling me additional. So I thought I was kind of getting over the scare. And, COVID started when my daughter was 6 months old. So once I realized, okay, I'm a little impacted by this, I need some help, some professional help. It was, trying to find a therapist online, which I talked to a therapist a couple of times, didn't really connect. So I'm like, well, at least I got to talk about it. And that means talking to someone. My husband was in the room when all of this was going on. I still picture him like on the floor thinking he was going to go in the operating room. So he's like trying to put his shoes on, and they're like, no, sir, you're not going. He's like, what? Okay. Like, we're just taking her, and we'll keep you updated. And I can like hear my mom freaking out. Like,
oh my goodness.
But, yeah. So once COVID started, it made it a little more difficult to find help once I realized probably do need some help, because the thought of a second kid was no thank you.
I can imagine. Now, did they have you on Pitocin for your induction of?
Yes. And then there was something else. What's the other?
Cervidil?
Is that one of them? Causes
Cytotec?
One of them.
So the Cytotec is a little pill that either they have you swallow, depending on whatever algorithm they're going with, or they can put it intravaginal against your cervix, and
so I had something like that.
Softens. It's for cervical ripening. Yes. Or sometimes they use this shoestring looking medication that does the same thing. It's like on a little shoestring. It's called Cervidil, and then they
can check it. The string, is that what it is? That for some reason rings a bell.
So with the Cervidil, if your uterus is doing a lot of like like crazy contractions and baby is not tolerating it too well, the good thing with the Cervidil is they could pull it out with the string.
Yeah, I think I remember that. And then the Pitocin was the drip, right? The IV.
The Pitocin is the drip. Yes. Yeah. Wow. Okay.
Yeah. So I still to this day don't know what caused the rupture.
Unfortunately, that's one of the not so good adverse reactions that could occur with induction of labor, especially using
Okay. And
Pitocin.
right. So I said I didn't do any research, right? And so when she started talking induction, I'm like, I just want a healthy baby. I just want to be safe. Whatever, I've trusted. And I don't necessarily blame the induction, but I do wish that I would have waited a little bit longer um, to kind of let it ride out a little bit longer, more naturally.
Mm-hmm.
But I do believe and feel that the induction process had a play in the situation.
Okay.
So I would think twice about that again.
How big did baby end up being?
7 pounds, 10 ounces.
Okay.
And they were thinking she was going to be 9 or 10.
Wow.
So,
Okay. That was a big difference.
right.
Dr. Julie, does any of this sound familiar to you as far as the way this played out for her?
Yeah, absolutely. Like some of the things that I'm hearing from you is having to piece things back together because no one sat you down and kind of did a recap, or no one really explained to you, here's what was happening. No one was explaining it in the moment. So that becomes really scary. And it sounds
Right.
like, you know, sort of intuitively, that's what
Right.
your body was doing, was like, what's
Mhm.
happening here? Like, I'll do it, but what's going on?
Mhm.
Um, that people blacking out that can, or losing time, even after the fact. And I recognize that you are put under, and so it makes sense too with
Mm-hmm.
anesthesia. You might not have memory of events before or after. Um, and sort of that taking time of figuring out, of reorienting yourself, of like,
Mhm.
where am I? What happened? Who's that baby? Why do we have a baby in here? All of that kind of reorientation sounds really familiar as well. Um, and that piece too, I think, and I think I might be extrapolating this, so please feel free to correct me if I'm wrong, but um, I think the sense of having to be fine because you have a baby and you have to care for the baby, and thus there's not time for you not to be fine.
100%.
Um,
Yes.
so that is also something I see, unfortunately, all of the time.
Right. And kind of piggybacking off of that, I also felt that I needed to be fine for everybody else. I mean, my husband was completely mortified from the whole experience, and I fully understand why. Um, but wanting to show, like, it's fine. I'm okay. She's okay. We're here. We had a little hiccup. We joke because I had told him, I hope my water breaks like I'm walking through the mall, or I hope I had a very easy, happy-go-lucky pregnancy. I'm like, oh, something exciting happens when I go into labor. And he's like, well, how is this for excitement? Like, okay. So something exciting I was talking about, but it definitely is a story to tell. So,
Well, and I think it's really hard too when you're holding trauma.
mhm,
And I imagine your mom and your husband
mhm,
were also holding trauma as
mhm,
well, because it's not like they knew more than you did. They were
mhm,
also in the dark. And it's scary to go for an emergency C-section. It's
right,
amazing that they were able, from, discovering, hey, something's not right, to,
right. How
you
quickly,
know,
right,
getting your daughter out was 12 minutes. That's amazing. It's supposed to be quick. That's
right,
good. That's a well-oiled machine there. And it's really scary when something moves that quickly because people are in the dark and they don't
mhm,
Yes.
really know what's happening. And I would say best practice is to leave some kind of health professional behind so that they can explain, here's what's happening now, here's what we're doing.
right,
Someone who might not need to be in the surgical unit, but to be able to explain to the family, here's what we expect, Here's what you can prepare for, just so at least your husband and mother aren't going to be as traumatized.
Right.
If we don't have information, we fill in the blanks. Our brains are really good at creating stories. And the stories we tend to create are not like everything's wonderful with rainbows and butterflies, but it's like worst case scenarios.
Right.
Right.
So it's even more scary. It's more activating to our nervous systems.
Right. And then trying to
Absolutely.
get that thought out of your head that, okay, no, it didn't go worst case scenario. Here we are. It's fine. But your brain's not 100% believing you that because it's not fine.
And you made a really good point, which is this idea, Chelsea, of, I just wanted a healthy baby. And you know what? Your outcome was a healthy baby and you were fine. I'm going to put that in quotes there.
Mhm.
And we don't think about that actually you weren't fine.
Mhm.
And just because you have a healthy baby doesn't mean that there isn't trauma.
Right. Because I heard her mention before about having another baby.
Mhm.
Yeah.
Hesitation toward, having a future baby. Has that been something that you guys have been able to work past, or is it still like?
Yeah, we definitely have worked through it. I wouldn't say that there's definitely fear. I don't think that will ever go away. And even my doctor now is like, well, you're a candidate for VBAC. I'm like, we're not even going to talk about that because I don't even want to. No, I don't even want to consider, as great as it might sound. Sure, that would be wonderful to do. It's not any end goal that I ever had. I just, again, healthy baby, whatever we got to do. So no, thank you. Please schedule it ahead of time. And my husband can be in there. I can be coherent, can understand what's going on. Sounds great. Thanks.
Definitely no Pitocin because you'd
Right.
be at higher risk for, uterine
Right.
rupture, being that, that has happened before. Definitely no Pitocin.
Right.
Or any, if you're coming in rip-roaring labor on your own, that's a whole other story.
Right.
Right. Absolutely. Okay, so did you finally get linked up with support during COVID? You said that it was a little.
Yeah, I did. I spoke with a therapist once or twice. I think it was twice. We had a couple sessions, but she wasn't really someone that I connected with. I kind of was just grasping for anyone because on top of realizing what trauma I had gone through, I was working full-time, stressful, high-stress job from home with a 6-month-old. I think at this point she was 9 or 10 months and walking and just pure chaos. I'm like, okay, I need some kind of help here. My husband started working more outside of the home when COVID started. So all of that, I think, kind of triggered or, just made me realize, okay, we're not good. I mean, it's to the, I will never, ever, ever, ever forget those bright lights to the point where I don't go outside without sunglasses.
Oh my gosh.
Like the bright light just brings back all of the feelings and just the fear of that moment of just, sorry, I'm jumping ahead.
So the bright light is the trigger.
Oh yeah, 100%.
Wow.
So what I hear from you is that this trauma from 4 years ago is still very alive and present today.
I would agree.
Yeah. Yeah, because if you're talking about like what do we do to compensate or how do we manage triggers or maybe avoid triggers or things like that, it sounds like there's some symptoms of potential PTSD. And
Right.
that makes sense to me then that you're like, no, I'm not gonna have another baby. Why
Yeah.
go through all that?
Yeah.
Let's go. Okay. Easy solution, right?
Yeah.
Not to do it.
Wow.
Yeah. So it means that the trauma is now making decisions for you versus you being able to make these decisions.
Yeah, we hadn't totally crossed out the idea of a second baby. I mean, I think that was my perfect world, that we would have had one already if we were going to have two, which I've always wanted multiple in general. And so as my husband, we both come from families that have multiple kids, but it's not something now that I'm rushing towards. And so it's not totally off the table. And I think each conversation, it makes it a little bit easier to get on board, but definitely not a VBAC. I will schedule it.
Totally. I would imagine that pregnancy in and of itself might have triggers for you.
Mm-hmm.
And I recognize that, like, you did not have a good fit with a therapist the first time. I totally get that. Sometimes it takes many opportunities to find a clinician that is suited towards you and has the skill set that can help you and that you sort of intuitively trust. But I would love for you to be free from this trauma, because I hear that it's holding you and maybe holding you back, which is what trauma does to us. So again, it's not sounding strange to me, but you know, I've worked with so many people, and I'm not saying me, so I want to be really clear about that, but just, you know, knowing what it can look like for people to have freedom from that trauma and then be able to be empowered to really make decisions and feel good and authentic about their decisions without the trauma being a voice in it. That's what I would love for you.
Right. So I read, you know, different types of, I don't know, but different types of therapies. There's, I guess, different methods, if that's the correct word. How do you pick which method you think is best for you to overcome?
It's, you know, very individual, of course. I am trained in a couple of different trauma modalities. I'm trained in something called EMDR. So that's eye movement desensitization and reprocessing. And I'm also trained in another modality called brain spotting. Those are two modalities where they are super effective in terms of taking away symptoms of trauma. And, you know, there's other ones too. So there's cognitive reprocessing therapy. There is, oh my gosh, I'm blanking on the name of it. But I think it depends. I think a lot of it depends upon who you gel with in terms of a practitioner. I mean, I am someone who tends to gravitate toward EMDR. I have not only been a practitioner of it for a while, but also have had it myself for my own reproductive traumas. And it is incredible in terms of not feeling so gripped by the trauma that, like, I can talk about it and not feel like I'm there and not feel like I'm going back and not feel that well of emotion and not, you know, and I can see things that might trigger me and be like, no, I'm not triggered. Like, okay, I get it. And that's similar. And oh, okay.
Yeah.
So I have a calm nervous system when any of this kind of trauma adjacent stuff comes up for me. And that's, I know EMDR is something that can do that, which is, you know, one of the reasons it's a well-validated modality. It is something that the VA has as a trauma modality for veterans. The American Psychological Association has vetted it as a evidence-based trauma modality as well. So I think it's just sort of like what's going to work best for you.
Yeah.
Versus like, oh, there's a one size fits all for everyone.
Right. Yeah. I think another trigger, and actually, I don't think this is a trigger. Well, I don't know. So I was the first of my friend group to have a baby. And then as soon as I gave birth, I found out one of my best friends was pregnant. So we have kids that are 9 months apart. And since then, I've had four of my closest friends have either had babies or are pregnant. and I was a hot mess, especially the first friend pregnancy. And I'm like trying not to show my anxieties and fears. And of course, my closest friends knew what I went through, but I'm like, okay, just I'm trying to gently say, like, just kind of do your research a little bit, talk to your doctor, ask questions, ask all the questions, get the questions answered, and stay in touch. And then my friend ended up going into labor for 36 hours. I'm like, can somebody update me before I lose my mind? Is everything okay?
Yeah.
Wow.
Well, that's such a good point too. Like, there can be things that are activating to us and bring us back to our trauma that have nothing seemingly to do. But,
Right.
It makes sense that you equate pregnancy is not a safe thing, right? That's in your brain. That's what's linked, is that like pregnancy is not safe. And so anyone that goes into pregnancy, they're not going to be safe. And so like it makes sense that you had anxiety and fear for your friends.
Right.
Wow.
Yeah. Told myself to tone that down, which I wasn't bringing it to her exactly, but I'm texting her boyfriend like, okay, I need to know what's going on. Like, well, calm down a second.
It's a hard thing to tone down because again, like there's a link in your brain that says this isn't safe.
Right.
my friend's in danger.
Right. And I don't have any control because I'm not there. I don't know what's going on.
Fight or flight.
Yeah. What is what it feels like, I'm like,
it is. Well, that's
definitely not trying to like mortify anybody and make them scared as they're going into labor.
No.
They all know what I've been through. And I think everyone kind of close to me keeps it in the back of their mind, but it's like, okay, I'm just here asking to see how you are. Hint, hint.
Yeah.
Right.
Your brain's doing what your brain is supposed to be doing, right? When it senses danger, it's supposed to act. And when it acts, it's not based upon rational thought. It's acting based upon what is most primitive to us. So just as Saafiyah was saying, fight or flight or freeze.
Right.
That's what we do. That's what our autonomic nervous system knows what to do, because if you can see my hand here, there's 3 parts of the brain. And so, well, there's more than that, but I'm simplifying it. So if we look at this part and we think of it as the prefrontal cortex, we look at this part and it's the limbic system, which holds the amygdala. That's the emotional center of our brain. And this part here is the reptilian brain. It's that oldest part of brain. It is in charge of all that automatic or autonomic functioning. It controls respiration and breathing. It's why when we wake up in the morning, we don't have to remind ourselves to breathe. We just do it because it's automatic. So when we experience trauma, the first thing that happens is our frontal lobe is gone. We do not have that power to think rationally, which means that we are left with, it's almost like if you think about the frontal lobe kind of being the adult driving the car, and the adult's just like not in the car. So instead you got a 10-year-old and a 2-year-old, and they're now driving the car. And that's not a good idea to have the 10-year-old and the 2-year-old driving a car. That's not going to get us to a good place. So it means that you have the 10-year-old going, we're not safe. And with the 2-year-old being like, okay, we run or we freeze or we fight it out. Like, we're going to do something. We're going to get an adrenaline surge, and that's activating our sympathetic nervous system, or we are going to fully shut down, and that is overactivating our parasympathetic nervous system, which is what, I like to explain the why, because it seems so strange, but it's what protected us from the woolly mammoths and the saber-toothed tigers. It's how we didn't get eaten.
And there's a theory out there, though, not to add more fear into the factor, but there's a theory out there that this whole adrenaline and parasympathetic system and autonomic nervous system thing, if it's activated often during pregnancy, that it can turn on the for lack of a better word, the likelihood of things such as preeclampsia, which is one of the, when the body is constantly going into fight or flight mode, that it can trigger that. So, that's another reason why it's important to address birth trauma before you go into another pregnancy. So at least, you could have maybe made amends with your feelings, reconcile your feelings, and try to kind of quell that tendency to always be in fight or flight mode during the next pregnancy, because it could put you at higher risk for things like preeclampsia. It's
Very
definitely
interesting.
related to that kind of stress response on the body.
Hmm.
Yeah, the body can handle a remarkable amount of stress, and yet it too has its breaking point.
Right.
Hmm. Wow. So Chelsea, let me ask you, how has the birth experience impacted motherhood with your daughter? Has it been okay, or is there?
Yeah, I actually think it made me a way more relaxed mom.
Okay.
Um, I have friends all the time that are, you don't act like a first time mom, and just even random people. I've just always, I thought I would be a little bit more helicopter, quote unquote, if you want to say.
Hmm.
Not at all. Just, okay, I'm watching you. Do
You
you,
just chill.
girlfriend? We'll figure it out. If something goes south, I'm not going to let you danger yourself. It's not, an extreme laxed. We definitely have our structure and whatnot, but I think starting the way we did just gave me some realizations that it's good. No need to, over analyze and over react, I guess you could say, to
Hmm.
toddler's gonna be a toddler, baby's gonna be a baby. Let's just chill and figure it out. So I'm kind of thankful for that. I enjoy the being relaxed and not constantly worried, which I kind of thought that would. I thought that's how it'd react, but it's been the
Okay.
opposite.
That's good. Now, Dr. Julie, do a lot of women turn into helicopter moms after birth trauma?
They can, but another really common thing after birth trauma is actually not bonding or attaching or attuning to your
Hmm.
baby. So,
Wow.
we can see lots of different things that happen on the spectrum. So, people who experience birth trauma have a higher instance of also suffering from a perinatal mental health disorder. There is a correlation between the two. So, that might also be an explanation for why some of what I'm describing can happen, where you might
Mm.
see um, moms either hyper vigilant about their babies and really worried about every sniffle or every kind of little thing, or you see moms that are really distant from their babies
Mm.
because their baby is what caused that traumatic experience, that it can be really hard. It's like, well, I have to attach to this baby, or like I have to at least feed the baby and do all the things that
Right.
I'm supposed to do. But also every time I see that baby, I'm
Reminded.
re-experiencing and I'm reminded of this
Mm.
horrendous thing that happened to me.
Yeah, I think maybe that's a memory that I've kind of blocked out. But the first few weeks, month, I would agree with that. That I did have, a, you hear everyone, oh my God, it's going to be the best love of your life. And yes, 100%. Now I totally agree. And I'm like, wait, am I supposed to, like, at the time, am I supposed to love this baby more? Like, I
Yeah.
love her, but everyone like says all these, super emotional things and this connection and then I was having problems breastfeeding and things of that nature. So then stacked on top is this thought that, oh, if I'm not successful at breastfeeding either, then there goes everything.
Mm.
But I would agree that the first month, 2 months, I did kind of struggle with just allowing myself to create that emotional bond. Something in me was kind of holding back.
You raise a really good point too, like when there's additional kinds of complications or that postpartum period isn't going in the way that you expect. Like it compounds these feelings of I'm not a good mom, or my body betrayed me, or my body's not doing what it's supposed to be doing. Like all of these negative beliefs that we start to internalize.
Again, my body is failing me.
Right, exactly. Like, here's another way my body failed me. Here's another thing it can't do. This is something I'm supposed to do because, isn't anyone with a uterus supposed to be doing all of this stuff?
Right.
I know the breastfeeding piece is tricky, particularly if you have a prolonged period of time that goes past that you're not actually interacting with the baby postpartum, like that golden hour. Like if you miss that golden hour, it's hard to catch up after that until like the baby is a couple of days or even weeks or older. So yeah, I understand that struggle. And you said you were in the OR for 3 hours after the C-section. So I can imagine that golden hour came and went,
Oh yeah, there's nothing golden about those hours, that's for sure.
Right. Oh my goodness.
Yeah.
Wow.
Too.
So what would you say some of your coping mechanisms have been?
If I have any. At first, I just shoved it all down. So there weren't any. Now I think it's talking about it, understanding a little bit more what happened, and just I don't it's a hard question. I think I'm just to the point where I'm just moving forward. I've kind of accepted what happened. That wasn't to anybody's control. It wasn't to my control. It's not something that, could have been avoided. So why dwell on it? But then also just keeping those lines of communication open, especially with my husband, and talking about it when I am feeling, pressured. When I start feeling pressured for baby number 2, that's when it kind of spikes. But just keeping those lines of communication open definitely helps. And really, like, I just love being with my daughter in general. So just if I am having hard times and whatnot, just being reminded and being with her. But I don't think I have any real specific coping mechanisms.
Okay, well, that's fair enough. Dr. Julie, how do you usually see people trying to cope on their own from this?
So I think actually Chelsea's experience is pretty similar. People try to avoid as much as they can. So again, whether that is avoiding things that are associated with what is traumatic or what feels traumatic, avoiding changing what their family plans might be. That's another way that people cope, because it's like, all right, if I don't have to put myself through this again, then I won't. And that makes a lot of sense. I think oftentimes people really just want to be okay. Like they just want to be like, look, it's done, it's in the past. But just because we know it to be in the past does not mean that we feel it to be in the past. And so oftentimes our bodies hold on to it, even though part of our brain is like, no, I don't need to think about that. I don't want to think about that. It's not useful for me to think about that. sometimes people will take on coping mechanisms like drinking, like doing drugs. It's a way of numbing themselves. And so that can be really useful too. I'm not saying that's healthy, but it is what people tend to do. So I just want to acknowledge that like it's not something I endorse, and
Self-medicating.
I want to recognize, correct.
And I think that was one of the first things that kind of sparked my husband kind of like realized, okay, I need to, keep my eyes. I told him, I said, I don't want to turn to drinking. I need you to be watching out for me. I say I didn't research anything when I was pregnant. I researched baby sleep and I researched the fourth trimester. I was looking past what was going. I need my sleep, and I wanted to know what my body was going to go through, what I could expect afterwards, not at the time. So I did tell him, look, I am mortified of postpartum depression, and I need you to be vigilant at watching me. And if something seems abnormal, I need you to, get a hold of my doctor, do whatever you need to do to make sure I don't go down a dark hole, because and then when the birth happened, I was, okay, now we especially need to make sure neither of us go down this dark hole. But yeah, said, if you see me drinking more than I normally do, I need you to please softly, gently talk to me, or get somebody to talk to me, because I don't want that to be the coping mechanism.
Yeah, and coping can also be burying yourself in work, or which men can do a lot when they experience traumas. They bury themselves in work, or it might be not being able to put your phone down, right? Like just the endless scrolling on your phone, because that's a way of distracting yourself.
Right.
And if you're in your phone, then you can't be in the present, or you can't think about the past, because those are just two places that are too overwhelming right now.
I was very eager to get back to work after maternity leave.
Yeah. I probably, the recommendation I make for people, if they're finding like, hey, I'm not really managing on my own, is therapy. Like, this is not something that you need to or necessarily can fix and solve by yourself. And that does not mean there's anything wrong with you or that you're deficient in any way, but it is really useful to have a trained professional that knows what they're doing around trauma, particularly birth trauma, to help work it through with you. So that it doesn't have to haunt you. It doesn't have to grip you. It doesn't have to steal your joy and take away your autonomy in making decisions.
Absolutely. Chelsea, if you had some words of advice or insight to other women that may have experienced birth trauma, what would you tell them?
Don't suppress it. Don't try to think that I'm not able to find the word that I'm looking for right now, but it is as big as a deal as you think it is, and don't let anybody downplay it. Don't downplay it yourself. Ask the questions, seek answers, seek help, talk about it. I was telling Dr. Julie, I said I didn't research pregnancy because I didn't research pregnancy. I researched infant sleep and the fourth trimester. And no one knows what the fourth trimester is. Nobody talks about postpartum depression, postpartum life in general. It's just, oh, you have this beautiful baby. Look at you and look at this beautiful baby that you birthed. Great. Are you breastfeeding? it's not, how are you, mom? How are you doing? And in our situation too, I think that my husband deserves some of that as well. How are you doing, Dad?
Absolutely.
It happened to me and baby, but
Happened
he
to
was
him.
right there along with it, and that gets pushed aside too. It's like, and my mom too, anyone who was in the room, everyone. So I would just say, don't downplay it. I wish I would have been more headstrong and looking for answers faster than I did, so that I could be coping better, faster.
You raised such a great point, Chelsea, with that anyone in the room, so that could be your husband, that could be your mom, that could be other healthcare providers.
Mm-hmm.
Any of them can experience birth trauma, even though none of them are the birthing person.
Mm-hmm.
And so I think that's a really useful and impactful, and that's why I just want to emphasize that point, is that there are occasions where the birthing person doesn't experience the trauma, but it's their partner that experiences it as trauma. And so there's lots of different ways that this can look. But you're right. We ask about the baby and how's the baby, and that's where our focus is,
Mm-hmm.
which I think also then gives this idea of, oh, well, you just have to be okay because you have a healthy baby. So what are you complaining about?
Right.
It wasn't
Right.
that bad, right? You
Mm-hmm.
didn't die. You're fine. You're here.
Right. And I think that's what makes it so easy to tell yourself, like, oh, I'm good. Like, I'm fine, because we're here and everyone's, everyone's goo goo gaga over the baby. So this is great. Isn't this, what the end goal was anyways? We made it here.
Yeah.
But
yeah, no. And I think, people's mental health in that fourth trimester gets very overlooked because we're focused on how to operationalize having a baby. Like, what are the mechanisms we need in place to take care of a baby, which is important. But so is mental health, which is impacted by lack of sleep, which is impacted by not eating all the food that we need to eat in a day because, oh my God, we're taking care of a baby. And who has time to make ourselves food or to clean the dishes or to do those things that are easy to do normally?
right.
But with the baby, our world gets turned upside down. So, I tell my clients when they're postpartum, like, any day you can shower is a good day. Like, count that as your win. You showered, amazing. Like, anything else is just gravy, but like, you showered, woo!
I'll never forget my shower at the hospital after I think it was the 5th day when we were about to get discharged. I didn't know that we were getting discharged that day. I just finally felt fine. Like, let me try to take a shower. My husband's like, oh Lord. So I had him and a nurse. He was terrified. I'm like, okay, I'm scared too, but I think I'll be okay. Took a shower, blow dried my hair. I'm like, oh my gosh, I'm a whole new person.
A shower always makes everything better.
Yes.
Wow. Okay, well, Dr. Julie, you had mentioned earlier some of the treatment modalities. Now, would you recommend that this late in the game, 4 years out, that Chelsea could still benefit from some kind of a counselor or mental health provider to help her with continuing her healing process?
I would say 1,000,000% yes. So it's never too late to embark on healing. And again, like, there is a degree that we can do on our own, and then we get to a point where we really need someone else to assist us. And so, if you're open to it, and I'm happy to talk offline with you just about, like, hey, can we help find you a good fit? But if you're open to it, I would love for you to consider it again, because as I said, I would love for you to be able to make decisions about your future and your future family without it being through that specter of trauma, right? Like right now you're looking through the lens of trauma and everything gets tainted because of that lens. And what might it be like to take that lens away so it's not there and you can actually make the decision that's right for you and your family without it clouding it?
Absolutely.
So
Yeah, I would love any input on finding a good
cool.
for me.
We'll talk offline then.
That sounds great.
Yeah, happy to.
Thank you.
Dr. Julie, is your practice more in person, face to face, or do you offer online like telehealth?
So I run a group practice, which is nice. It's not just me. And many of us are licensed in multiple states. So we can do virtual therapy in multiple different states. We also offer in-person therapy, but I think, for a lot of us that work with adults, we're doing a lot of virtual work because it's easy.
Convenient. Yeah.
Convenient and easy, and you know what, it's just as effective. So so there's that piece to it. But as I said, because this is what I do and I've been doing it now for a decade and a half, like I have a really good network of people and always happy to connect people with other people because healing is important. And again, being able to have the freedom that comes with healing is just, it's priceless. It's freedom, right? And when we're talking about freedom, you can't put a price on that. And yet it's something that everyone deserves and not everyone gets.
Absolutely. Absolutely. Well, that's great. Well, that is one of the best things that could possibly come out of this podcast is to connecting Chelsea with the resources that she needs to move forward.
Yeah.
So I'm happy about that.
Awesome.
And then, of course, there's always like some self-care things you can do at home, long baths, journaling, just talking about it, going out to brunch and getting into groups with other people that, want to share their experiences too,
So
are all
I'm going to issue a caution about talking about it because
okay.
we used to think that talking about trauma was the way to go, and that's what heals trauma. And
Mm-hmm.
what we've learned through PET scans and MRI studies is that talking about trauma over and over continues to activate the amygdala. So it's as if someone is experiencing that trauma reaction every time they talk about it
Oh,
versus
wow.
what we want to do, which is dampen that amygdala response. And so I want to caution people about listening to other people's traumas or talking about their own, because there's a point where talking about it is actually not helpful. And it's not to say you should never talk about it. I'm not trying to be all or nothing here, but I
Mm-hmm.
do want to caution people that talk about it if it feels doable to do so. Don't force yourself to do it because
Right.
you're not actually getting gain from it. You're harming yourself. You're re-traumatizing yourself by doing
Makes
that. And
sense.
that's what research has shown us just in terms of what happens in the brain around
Mm-hmm.
it. So I just, again, think that's sort of an important piece. Like I know people who will go to groups after pregnancy losses, which are another kind of reproductive traumatic event. And on the one hand, they're hoping to find solidarity with other people who have had similar experiences. But on the other hand, they'll come back to me and they'll be like, that was worse because now I know all the other ways that this can go bad. And I've heard stories that are even worse than mine. And I didn't know that there could be stories worse than mine.
Yeah.
And so it's not necessarily always helpful. So I just like to issue caution around it. Groups can also be wonderful things. Absolutely. But I just want people to be really judicious about how that's part of self-care, right? Is not putting yourself in an environment that is not going to be one that is caring for you. And self-care might just be sitting and breathing, right? Not even meditating, but just teaching yourself how to do some deep breathing. Self-care does not have to be a massage. Self-care does not have to be, a 30-minute bubble bath if we don't have time for that. Self-care can be mindfully eating a piece of dark chocolate and just
Mm-hmm.
really enjoying it. Self-care can be hanging out with friends. Self-care can be petting your cat or petting your dog. All of those things can be self-care.
Absolutely. Absolutely.
Good
Well,
points.
I appreciate everyone's time. If anyone needs any more resources, here's one resource that I found. I didn't find a whole lot of like professional organizations geared toward birth trauma, but I'm just gonna put this up and put this in the details as well for people that might want more information on birth trauma and how to move past it, how to heal from it. And then, of course, Dr. Julie can be reached via her website at www.greaterwashingtontherapy.com. You might want to look her up if you have any history of birth trauma or know somebody that does. She's a great resource.
Thank
All
you.
right. Thank you so much for tuning in, everyone. And I want to just put it out there that we will be going live tomorrow, which is Thursday, July 13th at 6 p.m. CDT time. And our topic that we will be discussing is healthy credit and how to go about maintaining finances in 2023.
Mhm.
Budget, budget, budget.
Mhm.
All right. And thank you again to my guests and to the listeners and viewers. We'll see you on the next podcast. Goodbye for now.